am Dr. Yatin Desai from Ahmedabad. I am heading orthopedic department at Zydus Hospital, one of the largest corporate hospital in Gujarat, having capacity of around 550 beds with all specialities and multi-speciality hospitals and super specialities too. Probably we are ranked number one hospital in the Gujarat. Being an orthopedic surgeon, it's a very busy branch. And I have been practicing since last about 40 years. I was ex-HOD and professor and head of department at a teaching medical college in Ahmedabad known as VS Municipal Medical College. In these 40 years, I have encountered many cases. Almost I have done 30,000 plus surgeries, but there are a few interesting cases which are interesting to the medical fraternity. I would like to tell about those cases. As you know, fracture neck femur is one of the commonest fracture in the elderly patients. And since the longevity of our people in the country has increased from about 58 to 72, the problems of the old age also has increased. And this is one of the problems of the old age. An elderly patient, when he falls in the bathroom, sustains most of the time a fracture neck femur. Either it's a transcervical fracture or an intertrochanteric fracture. And to manage this fracture is most of the time is difficult. Previously, when the medical services were poor, say about 50, 70 years ago, this used to be the terminal event of a patient's life. So many complications occur because of not able to walk before 50, 70 years, and then he will develop infection, bed sore, etc., etc. But with recent medicines, even we have operated a patient who had a bilateral fracture neck femur of around 97 and 98 age, and today she is moving in her apartment at the age of 103. So this is the progress which medicine has done in recent time, especially in orthopedics. So the problems in this elderly patient with intertrochanteric fracture are, number one, the comorbidity conditions like diabetes, hypertension, pneumonia, liver diseases, less of hemoglobin, less proteins, less mobility, and fragile bones. So there are many, and most of the patients are operated either for CABG or something else. So all this adds to the risk of the patients. Even in United States, patients above 80 with such fractures, the mortality rate is around 8 to 10%. But fortunately, we at Zydus Hospital have been managing these cases for last 6 years, and almost 100 cases we have done, which are above 80, and we have fixed the fractures, and our mortality rate is hardly 2 to 3%. We have composite team. Now, this requires a composite management. Just fixing the bone is not important. A coordinated effort of critical care team, physicians, anesthetists, everything is important. The second would be a replacement surgery, which is known as total hip replacement surgery. Most of the time, with some arthritic conditions or avascular necrosis of the head of the femur gets degenerated in the head part and causes pain around the hip joint with difficulty in walking, restriction of movements, and inability to squat or sit cross-legged, and we replace the hip. In world literature, about 1% of the cases of operated THR have been reported with myositis ossificans of significant magnitude. Though smaller cases of myositis do occur more frequently, but they don't require any management. Surprisingly, we had 2 cases of extensive myositis ossificans after replacement surgery. In last 2 years, in last 40 years of my practice, I had hardly any seen such cases which requires a medical and surgical management. But this time, in a year, I got 2 cases. I operated one elderly around 68 years after an arthritic hip for total hip replacement. And gradually, when I followed him up for 1 and 2 months, I saw that he is developing myositis ossificans. The picture I would like to show you. This is the picture. You can see on the anterolateral side, there is a new bone formation which is definitely well defined, which was defined in 5 to 6 years after post-operatively, and it is X-ray. Now, this is the X-ray image of a developed, well-defined myositis ossificans on a case of operated total hip replacement after 6 months. This used to cause a total block of sort of ankylosis of the hip without ankylosis of the hip, not allowing any movement whatsoever. So it was difficult for the patient to get up even from the bed and stand on the floor. When we did CT, we saw that we we realized that this is a big chunk of bone on the anterolateral surface, and we had to remove if we wanted to give the movements. But then we were worried that removing also can not give 100% result, and can again aggressive myositis can happen. So we wanted to do something novel. We thought about it. We thought, why not take the help of the radiation therapy? It is described in the books that the radiation therapy after excision of the myositis bone can kill the fibroblast or neofibroblast, which later on differentiates to develop osteoblast and clast to form the new bone. So we took this help of our radiation technologist and the radiation doctor, and we gave him sittings of 5 days, each day of around 45 to 60 minutes, and try to burn the cells which are the precursor cells or the fibroblast from which the different tissues develop. And surprisingly, after 2 months, we have an X-ray which shows a very good result. Almost no bone there now, and patient is able to come out of the bed very easily, which he was not at all possible, and he was not able to walk even because he could not get any hip flexion or abduction. So after 2 months of radiation, we are following him up, but this is a very rare case which is not reported in Indian orthopedic literature, and probably very rarely reported in international reports also. So I have been specializing around hip surgeries like total hip replacement or hip surface replacements or fixation of an elderly fracture or fixation of complex acetabulum fracture. This is one of the common injuries, as I said, because longevity has increased and we have patients up to even 96 years. Even last week also, I operated 4 patients above 85 years of age with intertrochanteric fracture. So for general practitioner and for normal medical practitioner, this is one thing to be learned, that if they are sent, their patients are sent to a proper hospital where it's a corporate hospital involving multi-speciality persons and decent critical care department, then probably the mortality rate, which is described in US at around 8%, can be further lower. And it has been lowered in our hospital. As I said, in last 6 years, we had about 2 to 3% mortality. In addition to these cases, there are so many interesting cases like lengthening of the bone by Elizarov method. In this recent days, we have witnessed so many road traumas on the highways and the side roads because of high velocity accidents. And sometimes the fracture is compound when the part of the bone is lost and we can't put that bone in back. So there is a defect in the bone. And the question was how to shorten the defect or how to neutralize that defect. And we have been using Elizarov technique since about 15 years now, I think, and we have been happy lengthening the bone and getting the union of the bone in desired length. So that is again an interesting, very cornered aspect in orthopedics. May not be interesting for the normal medical practitioner, but these are the newer advances. The newer advances are also in the replacement therapy, like the surface of the implant which is used in replacement surgeries have been constantly upgrading, and we have chromium, cobalt, or even polysaccharides covers and others also that can increase the longevity up to 20-25 years, they say. Still, we are waiting for the results. But these are the newer advances. Again, the chondrocyte grafting in early osteoarthritis is a recent advance, wherein you take the cartilage cells, grow them in the laboratory artificially to a huge number, scrap the defect and put those cultivated chondroblasts there so that the surface may become almost normal. But these are newer techniques and still under evaluation and observation. I think this is enough. Thank you all.